Hello, Parkinson support community of Sonoma County. This month's speaker meeting is Voice and Communication Issues in Parkinson's Disease with Barbara Corinblit. Barbara is a retired head of the speech pathology department at Memorial Hospital. She will be providing practical strategies that can be used to maximize successful communication and share resources that are available in the community. Welcome, Barbara. We're so grateful to have you this month.
Thank you so much. And I want to thank all of you for the opportunity to speak to you today. My father had Parkinson's, so I know on a practical basis what kinds of things might be helpful. And I know how the process goes in trying to gather information so that you can best understand the symptoms and the strategies that are helpful in coping with this, with Parkinson's. So I'm very excited to be here. I will share the screen. This talk is called Voice and Communication Issues in Parkinson's Disease, and I want to provide you specific tools that you can use at home. So let me share first. Here are some questions that you might have. I'll go back just a moment. So there's 4 questions that you might come forth as you are coping with voice and communication changes. In this presentation, we're going to answer what strategies compensate that you can use to compensate for communication challenges, which devices make your voice better heard, how does speech therapy improve voice and communication, and how do voice and communication groups help. Toward the end of the presentation, we'll be doing a voice practice. So I want to take a moment to ask yourself a couple of these questions so that you can identify if there are issues that are being that you are aware of now. Are you frequently asked to repeat yourself, or is your speech an obstacle to participating in groups or talking on the phone? Or do you sometimes find that people interrupt you or jump in when you're speaking because they're not aware that you have something to say? And do people tell you to speak louder when you already perceive that you're speaking as loud as you need to? These are things that often occur. Now, for family and friends, if they're on today, do you find sometimes that when you're speaking with somebody who has Parkinson's, that you are speaking for them because you can't, you're having challenges communicating? Do you wonder why the person with Parkinson's is not speaking as much as they did before? Or do you sometimes feel at a loss as to how to make it easier for you to converse when you are alone with the person or in a group? So here are some concepts that a lot of people in rehabilitation refer to for people who have made good adjustments when they've had changes to their activities of daily living, such as communication. The concept of self-efficacy and resiliency really do drive positive outcomes. So when we look at people as to how they're coping, those that have confidence in their ability to adjust and are resilient do much better. If you take an active role in your rehabilitation, and if you have a strong sense of commitment to the goals that you set. These are attitudes that many of you have, if not all of you, toward getting better, which is why you're part of the support group. So what are the challenges that often occur when you have Parkinson's? There's a disorder called hypodysarthria, and that's a motor speech disorder. It's characterized by having a breathy voice or hoarse voice. Your voice might have reduced loudness, or the pitch may be more restricted. You might have an imprecise sound production or articulation. And your speech rate might be fast, or there may be long pauses. You may be aware of this, and you may not be aware of this, of these changes. And often, just so you know, these changes may not happen to you until a very long time that you've had the disease for a long time, or they may happen early on. Everyone is different, and I'm sure you're aware of that already. So when you see in the yellow, you see how it says soft. That means that when people speak, you perceive a person with Parkinson's often perceives that they're speaking at a normal loudness, but in reality, their voice is soft. And you really don't hear that your voice is soft because there's a change in your sensory perceptual abilities, sort of your auditory feedback. So you're hearing that your voice is the appropriate loudness. And yet the person you're talking to is saying, you're not talking loud enough, talk louder. So it's that mismatch that is a challenge. Communication is a team sport, so it really requires adjustments and honest feedback between you and whoever you're speaking with. One person can affect the communication of another person just by the behaviors they use. So working collaboratively between your husband and wife or communication partner will really make a difference. Now, in fact, along those lines, it turns out that 66% of communication breakdowns, when we are not able to get our feelings or thoughts or opinions across, are really unrelated to the fact that you might have a soft volume. Really, it's also your partner's response. When someone did an analysis of this, they found that people were talking over each other or talking for the person who has Parkinson's, or either the person or the communication partner were not making clear when they were changing topics or topic shifts that are too quick. So both of these observations are important. Now, what causes the breakdown between two people also has to do with the person who has Parkinson's and their pattern of communication and conversation. Sometimes there are long pauses that you might see. And when you have long pauses, when you have these long pauses, that can make things a little more difficult. There's also unclear nonverbal signals for turn taking or slower processing of information. And there's a delay in initiating. So someone may feel that that you've finished communicating or saying your sentence, and they start to jump in, and you really had something else to say. Let's talk about the steps we can take to maintain and improve our communication. The first thing to recognize, and I know all of you are very aware of this because you have other challenges in your gait, walking in your home, or other types of things that you have to compensate for. So the most important overall umbrella is that we have to be deliberate and intentional when we go to talk, as opposed to things being automatic. You have to remind yourself, oh, I have to use the appropriate techniques in order to have my voice loud enough, since I can't I can't monitor it myself. So we're used to speaking automatically. And now we're learning how to set up the environment and complete daily exercises so you can maintain your voice and your volume. And then you're going to learn specific techniques as to how to compensate. So now we're deliberate and mindful, and we're going to take a proactive approach. All of these suggestions that we'll talk about today, you may or may not implement, and you may implement some now and some later. But they are our possibilities. When you get frustrated, these are lists of things that you can do to make communication easier. The first one is talking about setting up an environment that is conducive to communication. There's a concept in rehabilitation called resource allocation. Resource allocation means how much energy does it take to talk to another person or to do an action. And when we're young, we have a lot of resources we can pull in our brain to be able to compensate if there's lots of noise around, if we're really tired, if we stayed up the night before. But when we get older and when we have something like Parkinson's, we have less resources to compensate for when things are not ideal. So that makes it a little more challenging. In order to maximize the ease of communication, there are specific strategies. So the first one is, in general, if you meet in smaller groups, it might be easier for you. Or you can choose the best time of day for social interactions. You can choose the best time of day if you're going to discuss things like finances or talking to your lawyer or physician. These kinds of things make a difference, because when you're speaking, when you're fatigued, it can be a lot more challenging. And certainly choosing a quiet restaurant or eating at a quiet dining time can be helpful. Now, it's not uncommon because we're all getting older, that someone might have a mild hearing loss. You might have it, but your partner may have it, and they don't know that they have it. So they're saying that your voice isn't loud enough, but one aspect could be their own hearing. So it's very important to get your both you and your husband or wife or partner should have your hearing assessed. Hearing aids are really helpful for the communication partner too, so that they can make all the difference in whether you can be heard. And then again, there's phone amplifiers for the listener, the speaker. People are used to having phone amplifiers for if you don't hear well. But if you can't speak well, there are weak voice amplifiers. And this is all provided free from the California Phones company. It's through the state of California. And you just need a form signed by either your doctor or a speech pathologist. If you have any questions about that, I can answer or provide that. I think you had a speaker come on that particular issue, our topic too. Now you want to set up the environment in a different way. You want to eliminate any distracting noises like water running or the television. You want to talk to each other face to face. I can't tell you, we've talked about this in our group several times, the difference that it makes after you make a commitment to go into the room that you're going, when you're going to talk to your partner, rather than to talk to them and yell from another room. It makes all the difference because you can pick up all sorts of nonverbal cues, and we all silently lip read. You're not aware of it, but you can certainly talk to someone a little bit easier when you can see their face. And it's always helpful to provide an alerter. Either say the person's name or tap them on the shoulder, because then they're ready to pay attention and concentrate on you. And of course, we talked about looking directly at each other while you speak. So for communication partners, do's and don'ts, you don't want to talk to the person from the other room, which is what we just mentioned. You want to facilitate so the person with Parkinson's can get into a conversation. If you're sitting with a large group of friends, you might turn to the person and say, what do you think, John, about what we've been talking about? Don't automatically jump in as much as it's a temptation. Don't jump in when the person cannot find a word. Give them time. And I know we all have experienced word finding problems, so we know what that feels like. And sometimes it just takes extra time before the concept comes back to you. Now, what happens when you don't hear somebody speak? Habitually, it's not uncommon when we don't hear somebody to say, what or huh? Can you say that again? But if you do that, the person has to tell the whole story all over again. So it can get rather difficult and fatiguing for them to repeat themselves 2 or 3 times. Instead, if you tell them the part of the sentence you did hear, or the part of the story or discussion you did hear, then all the person with Parkinson's has to do is fill in the missing words, and they don't have to tell the whole story all over again. So you could say, look, I heard, honey, that you wanted to go to a restaurant tomorrow with Bill and Jane, but I didn't get the name of the restaurant. It sounds like you have someplace in mind. Then all they have to do is fill in the name of the restaurant. If you really didn't hear any of the message, then it's nice to just say, could you say it again louder? And that will be just a cue to the other person. So really the biggest piece here is to give the person more time to respond. That's one of the takeaways. It's not uncommon for facial expressions and nonverbal communication to change. You know, you're used to reading your husband or wife's facial expressions to know that they're kidding, or they really liked what you said, or they're upset with you. But sometimes there's a change because of there's less range of motion in the muscles in your face, just like how it works when you're walking and when you're talking. And because of that, you might misread what someone says or what someone means. So here's a picture of two people who heard the same joke, and it says, facial expression, Jean and I are laughing at the same joke. I'm trying to smile, but the rigid muscles that are a symptom of my Parkinson's often make it difficult. I'm not being rude. I am not miserable. I have Parkinson's. So if you're uncertain if the person is making a joke or is feeling depressed, it's best to ask that person. And for the person who has Parkinson's, it's really important to express your emotions verbally in addition to non-verbally. Instead of relying on your facial expression, tell people if something they say makes you happy or sad or upset. And don't be afraid to tell them you're joking if they think something you say, if they take something that you say too seriously. Now, sometimes people have asked me about cognition, and really a neuropsychologist would be the best person to approach this, but many speech pathologists and occupational therapists certainly treat this also. So the definition of cognition is the mental process of thinking, learning, remembering, being aware of surroundings, and using judgment. In general, there are several things that can influence your ability to think clearly. And as we get older, our bodies are more vulnerable. So just having a urinary infection can make someone think less clearly. Having a B12 vitamin deficiency can do that. Blood sugars problems can also do that. So there are many reversible causes, and it's very good to get lab testing talk to your physician and get this ruled out, as that may be the culprit. There are symptoms that also lead to a change in cognition. People with sleep disorders or depression or anxiety, physical inactivity, medication interactions, hallucinations, all of these can influence your cognition, and some of them may be under your control once you talk to your neurologist or a psychiatrist or a sleep specialist. Or your support group, who might have all sorts of ideas as to how to cope with some of these changes. There are general strategies that really can delay or prevent cognitive decline in the big picture. You want to get adequate sleep. You want to reduce reactivity and stress by using meditation or mindfulness, or spend time in nature. All of those things can reduce stress. You want to eat a brain healthy diet. And a brain healthy diet is also the same diet that also helps with the blood vessels in your heart. So Harvard EDU has a list of brain healthy foods, but I think you can find them in several different resources. You want to exercise daily. Stay socially and cognitively active by doing exercise, whether it be the Tai Chi or the Rock Steady programs, playing cards with people, being on the computer and doing cognitive games. All of these things can help. And learning new things is always helpful. Now, there is a percentage of people who have Parkinson's that over time may develop difficulty with word memory, multitasking, problem solving, or seeing information three-dimensionally, visual spatial types of skills. This can be a safety issue over time, so it's not, it's a good idea to get assessed periodically by a driving school, for instance. You don't have to go to the DMV, but a driving school could just take you on a ride, a drive, and be able to assess that you're still safe driving. General information on memory, because this comes up for many of us. In general, there are three types of memory. That there's various classification systems, but one classification talks about muscle memory or procedural memory, like remembering how to ride a bike or cook or do other activities. Then there's semantic memory, which is facts and information, and sometimes that can be changed over time. The ability to pull out your general knowledge. And then there's episodic memory. Episodic memory are the sort of biographical information about what happened to you during your lifetime. And certain things that you might not be able to remember what happened yesterday, but you might remember something that happened in 4th grade. So it's rather interesting how our brain works. In general, for all of us, it's going to be easier to remember if it is one of the following. If it's meaningful, if what you're trying to recall is meaningful, emotional, if it's something that was surprising, or it's something that you've practiced a lot and you've intentionally wanted to remember. But I would not worry if you don't remember what you ate for lunch, or you didn't, who texted you yesterday, or how many people called on the phone yesterday. Someone might ask you those kind of questions. Don't worry if you don't remember them, because it might not have been meaningful or emotional or surprising. It might have been just routine information that you're not recalling. In general, if you're proactive about wanting to remember where things are located in your home and to general information, you can reduce the clutter, because that can actually help. Many people have established sort of a memory center in their home. That's where they keep the calendar and the clock, and might have some alarm clocks or alarms there, and easy to follow lists, like people that you want to be in contact with, restaurants that you like to go to, doctors that you have, and everything is very simple and easy to access. You want to keep your keys and your glasses in easy to find known places. Just having a basket that you near the front door that you always drop your keys in, or you keep your glasses for driving in. Many people keep a portable notebook, a small little notebook that they keep in their pocket, or they use their cell phone or a tablet, and they put things, they do their own category listings of important places, where they have the restaurants that they like to go to, the plans that they want to do for their vacations, or their things they want to buy at the store. They keep that as sort of a resource notebook to help. And then there's all sorts of fancy pill dispensers now, I don't know if you're aware, that will even have alarms on them, so that when it's time for you to take your medications, it'll ding and you'll be able to not forget to take them. Having cues and prompts are really helpful. Now, if you're talking to somebody who has slower processing time, and this can happen with some people in the course of the disease process, it's better if the person who has Parkinson's, it's really better for all of us as we get older, that we focus on one thing at a time and maybe do less multitasking than what we might have done at another time. If you're talking to someone, it's best that you sort of use words that will help you follow the sequence. So if you're talking to someone and you're going to give directions, either way, whether you have Parkinson's or you're the partner, it's easier, rather than to say, before you take your meds, make sure that you call your sister or something, or call the doctor's office. Rather than to say before, instead say, first call the doctor's office, second take your medicine, rather than using the term before. You want to give the person with Parkinson's extra time to process. Let them know when you're switching topics. Write down steps or reminders, and you want to check in to ask whether they understood what you said. You can say, was any of what I just talked about confusing? Or can you tell me what you understood from what I said that you need to do tomorrow when I'm at the office? If you want to remember specific information, there are other things that you can do. You need to be intentional when you want to learn something. It doesn't just absorb like it might have done before. You want to hear it, say it, and maybe write it down. Or you can do something to encode the information. In our speech groups, we often work on this. And I give people words at the beginning of the session, and they see if they can remember them at the end. And I have to say, our group has worked on this a lot, and they are excellent. And it really has changed over time. So you can remember by category. These are things that are this color, or these are the fruit versus the vegetables. Or you can learn, use associations, or you can make up a story about the three words you're trying to remember, or the three names. You can use guided imagery, remembering how the person looks, or using humor. Humor is very helpful, and making up something funny that will help you remember their name. You can also do rhyming if their name starts with something. And then you can practice recalling the information. So all of this is intentional rather than automatic. And of course, if you write it down, that is the easiest. Some people will say, oh, I don't want to write it down because it's a crutch or something. But it's really the ultimate challenge, or the ultimate thing you want to do is recall it. And it doesn't make a difference whether you recall it from in your brain or recall it by looking at a list. The bottom line is you want to be successful in being able to pull out that information when you need it. And then, by the way, on the phone, you can also, there's voice memo functions and reminders that you can put in there. The next area is when we're talking about specific devices, and there's all sorts of different devices that can be used to assist you in producing a louder voice. There are free telephone amplifiers that I've already discussed. There are handheld amplifiers. Those handheld things are sort of like the old Walkmans, if you could think about it. They're sort of the size of, we used to say, a pack of cigarettes, not that we talk about cigarettes that much anymore, but it's about that size, something that can fit in your pocket. And the amplifiers often have a microphone, and they sometimes have a cord or something that will amplify your voice that are right there. And the person who is listening to you, one type of pocket talker has it so that if you're just talking to one person in a restaurant, they have a cord that goes to their ear. And then you have the microphone, and you'll be able to hear each other even if there's lots of background noise. I want to stop for a moment and just say that there are people who have hearing losses, for instance, who will wear a bright red or pink hearing aid rather than try to hide it. And they say, listen, I want people to know that I can't hear well, so they don't talk with their hand in front of their face. And they look at me when they talk. So often we're concerned, oh, this will stand out, that people will know that I have a weak voice. But really, the more we are comfortable with our situation, the easier it will be to compensate for our challenges. So there's also something called a chatterbox. You can see that picture. It's a necklace that's worn around, and it also amplifies your voice. Or on Amazon for, I think, $30, there's a portable amplifier that has a microphone attached to it. There is another device that's used by some people that's called Speech Vive, and that is covered by Medicare. This one is covered by Medicare. You have a masking sound that's produced in your ear through a little device that looks like a hearing aid, and it produces a sort of a white noise in the back, because normally if we have background noise, we automatically speak louder. Somebody told me, I think it was Mark, who mentioned that he speaks louder if he pretends or imagines himself that he's talking on the phone, because he finds that when he talks on the phone, he automatically speaks louder. There are all sorts of methods to use. You can do this, use the Speech Vive on a trial basis and see if that's helpful. There's a method, a EMST, that has been studied. It's a breathing exercise device to help with your respiratory muscles. And then there are all sorts of apps on the computer. There's one called Loud and Clear that gives you exercises to help with your loudness of your voice. There's something called voice aerobics. There's many choices. Most of the studies that have been done and that are extremely evidence-based, meaning that they've done lots of studies throughout the world, actually, on many of these, really focus around two speech treatment methods. One is called LSVT, which focuses on loudness, and one is called Speak Out, that focuses on speaking deliberately rather than automatically. And again, that concept of being deliberate rather than just speaking without thinking, that is a hard adjustment to make. But you'll see that if you can make that adjustment, it will pay off. But that's why people who have Parkinson's, who are using all these strategies, get tired, because to do it all day is tiring. So it's best to do your important communication, like we discussed, when you're well rested. And you know, those on and off periods that you have with Parkinson's, take those into consideration too. The speech pathologist who works with you will calibrate your speech production with individualized strategies. Some people need to change their posture when they're speaking. Other people need to take a slightly deeper breath. There are many different strategies, but you'll notice that when we've done all this research, that you can't really mumble if you're speaking loudly, or you can't mumble or have slurred speech if you're speaking really deliberately, like you're talking to an audience. So just working on being deliberate or speaking loud changes a lot of the other aspects or variables to speech production and makes it easier for people to hear you. I'll just say quickly that the LSVT, the Lee Silverman voice treatment method, is a standardized method that people get certified in, and it focuses on loudness, high out, and high effort. It's very intensive. So it's just like the research that's been done in physical therapy. It's not so different. That intensive work, intensity of your practice makes all the difference. We have actually worked out the dosage, just like you might work out the dosage of a pill. If you had an infection of something, the dose that they have found most successful is either 4 days a week for 4 weeks with daily home practice, or that's their ideal, or 2 times a week for 8 weeks with intensive daily practice. But if you do the 2 times a week for 8 weeks, you have to be someone who doesn't mind doing homework twice a day rather than 1 time a day. There's a lot of follow-up that happens at home so that you'll build up the muscles. Because you know, if you only did arm exercises once a week, that will not change how you're producing your voice. But if you do it intensively, it will build up the mechanism, the strength and the tone of the vocal mechanism, so that you can maintain the changes a little easier. It really does require lifelong daily warm-ups, the same way that your physical therapy exercises do. And most of the research shows that joining a maintenance group or a group that focuses on speech production or voice is very helpful after you've had the intensive speech therapy. Everyone is different. Some people are very self-motivated and they can do this on their own, and they are loners or they prefer not to be in a group. That we all respect that. But if you're a social person and like the assistance, we find that the groups are very helpful. And then just know that Medicare does pay for periodic tune-ups, meaning you can go back every 4 months to your speech therapist and get additional training if you need to. So the second method is Speak Out, and they use increased effort to override small motor movements and strengthen the muscles. And where they're talking to you about being deliberate. So LSVT talks to you about being loud, and Speak Out focuses on being deliberate. It's very similar. And this method also requires certification by the speech pathologist. I happen to be certified in both methods. It's 3 times a week for 45-minute sessions for 4 weeks and daily home practice. So it's very similar. So now let's talk about the communication class. There are classes, communication classes online that you can find that are free and offered through various organizations. Like the Parkinson's Association may have one, or the Parkinson's Foundation. You can go on and explore. Sometimes those classes are large, or there may be variables that make it less appealing or more appealing to you. So I encourage you to do that. But the benefits, like I've discussed, is it gives you an opportunity to practice communication strategies. You really meet new people this way, and you get close to each other so that you're there to support each other, to laugh, to use humor, to give suggestions, in addition to doing your vocal exercises. So it makes it much more fun to do. And the one that I do on Zoom, if you have any questions, we do it once a week for an hour, and there's a small fee that's paid per month, just like taking any other class that you might take. And you're welcome to reach me at my website, through my website at barbaracorinblit.com. You can call me, or you may email me, bcorinblit@gmail.com. Maintaining a strong voice. So here's the overall picture. When we talk about the big picture, you want to, when appropriate, when you're ready, seek out speech therapy treatment and reassessments. That is very helpful to do. Practice your short daily voice drills. You can do it in the car, you can do it in the shower, you can do it while you're doing your physical exercises. You can call up a friend. We have 2 people in our group who talk twice a week, and they do a wonderful job. And they come up with all sorts of new practice material for them to work on their voices together. You can be deliberate and implement the think loud strategy throughout the day. And your partner may provide you some cues, or you can even put Post-its on the refrigerator to remind yourself. Participate in a group. Sit down and be honest with your communication partner. Are you really listening to me, or do you have difficulty listening to me? Be honest and ask this question. Do you sometimes pretend that you heard me even when you did not? This is extremely common. And by being honest about it with each other, then you can come up with strategies that will help. And again, maintain a sense of humor and keep talking. There are resources that have very easy and very practical suggestions. And 3 of those are the American Parkinson's Association, the Parkinson's Foundation, and Stanford University has a webinar on communication strategies. So thank you so much for this, for participating with me. It's been absolutely lovely. What I'd like to do now is do a group practice that we can do together. You can see here that the listing of what the exercises are, and I'm going to stop the share and we'll do those exercises together. So our first one, I know it's hard to remember what they are, but our first one that we could just try out a couple, we'll just do a couple of them, is when you hold, and these are done in speech therapy. You want to hold the sound ah as long as you can. Now, when you do this, you don't want to strain your voice, but we'll just try it out. So please feel free to do it along with me. So I'm going to, and you're going to make it as loud and as strong as you can. 1, 2, 3. Ah. Good. All right, that's one thing. And you'll see that, and when you push all that effort out, it'll be louder than what you would even imagine that it could be. We'll do one other of those types of exercises where we're going to go from low to high. So we'll go from all the way up. 1, 2, 3. And you do that, and you're stretching your instrument, you're stretching your vocal cords, you're using all the muscles that are around your vocal cords so that they can get stronger, just like you might do a stretch in your arms or your legs. And then, of course, the other one is when you go all the way down with the word boom, you go all the way down deeply. But now let's everybody say really loudly, as loud as you can, good morning. 1, 2, 3. Good morning. So if you were all sitting with each other, you would hear how loud your voices are. They are very loud when you put that kind of effort in. That tells you that your vocal cords can work. They will be louder. Your voice can be louder, but it takes that kind of effort. That gives you the feedback that your voice doesn't have to be as soft as it might be. So I'll say the last one that we'll say loud, which will be the phrase, let's do this. Let's do this. Let's do it as loud as you can. As loud and effortful. 1, 2, 3. Let's do this. See how loud it might be able to get, and you will find that it can be very helpful as you practice. Now, a speech therapist will work with you because the volume by itself is not, needs to be tempered sometime to make sure that you don't strain your voice, you don't get hoarse and doesn't bother you. The next step is to really go to a speech pathologist so you can get training for it, and it is covered under insurance. I want to thank you again for giving me this opportunity. It has been a great pleasure, so thank you.
Thank you, Barbara, for showing up for our group. We're going to be that was such a wonderful presentation. And it's good for even those of us who don't have Parkinson's. And it's certainly good as people who are partners or family of Parkinson's, friends of Parkinson's, to know how to respectfully communicate with the limitations that can come with Parkinson's and having our voice in communication. So once again, thank you, Barbara Corinblit. It's been wonderful to have you.